Simulation is so important for nursing students because this is a psychologically safe space for them to practice these pretty high stakes, nursing judgments that they're going to have to make with real patients eventually, with real consequences. But they can practice those skills here in a way that is not going to be, detrimental or impactful to a patient if something goes wrong. And of course, honestly, we want mistakes to happen here because mistakes are how we learn. So anything that happens here, a mistake, something great that they did, they're going to take that with them, learn from that, and carry that on with them into the real world so that they have that knowledge and they have those skills already built in, kind of in their back pocket when they're practicing with real patients. Our simulation space down here is set up so we have 4 hospital rooms, and then we have 3 office rooms. So those are usually used by our master's level students. So we try to keep it as realistic to an actual hospital as possible. So students can, take time, do their planning at the nurse's station. They'll withdraw meds from the Pyxis, and then they'll enter their patient's hospital room. Behind all of the hospital rooms, there is the controller space. So that's where we as operators sit, and that's where the faculty will watch the students for evaluation as well. So there's a 2-way mirror that we sit behind, and that's where we control the simulators. We can make the simulators respond in a meaningful way to the actions that the students are taking. In our new building, there will be almost a whole floor, it looks like, in the plans dedicated to the simulation center. And we'll actually share some of that simulation space with HCA. I'm really excited about it because I think it's going to be a way for us to continue or expand on our interactions with HCA so that we are training our nurses in a way that is going to be most beneficial for them and also allow the easiest transition for our nurses into those hospitals. The simulations that take place here, anytime a student is in a class that has a clinical component, they'll be down here. So they're very nervous. But afterwards, just to see that they're always smiling, they're always laughing when they get done with the simulation because it's a sense of relief and also a sense of yeah, I can do that. So I think that's a moment when they almost transition into feeling like full nurses because they're like, that's a scary thing, but I know that I can do that. So just seeing how the students, transition during that time is really special.